welcome you here to the 2013 CROI, and we're here with the young investigators, young people that are in their fields that are brand new to them, and they're going to be moving along down the road to successful careers. So we want to introduce you to each person. The first person is Adrienne, and we want you to tell us just a little bit about yourself, who you are and where you're working, your affiliation.
So I'm Adrienne Swanstrom. I'm a graduate student at the University of Pennsylvania. I'm in my 4th year working with the director of the Center for AIDS Research, Jim Hoxie. And I'm a basic scientist, so I spend my days in a lab. I work with a model system called SIV, which is a simian version of HIV. And we use rhesus macaques to test infection models and the immune response.
Great. And Sujit?
So my name is Sujit Suchindran, and I'm an Infectious Disease Fellow at Massachusetts General Hospital and Brigham Women's Hospital in Boston. And I work primarily with Dr. Jean Triant and Dr. Steve Grinspoon, looking at cardiovascular and metabolic complications of HIV. And just started in this field after finishing my clinical training.
Wonderful. Summer?
All right. I'm a pediatric resident at Seattle Children's Hospital at the University of Washington, and continuing HIV research I started in medical school with Scott McClelland and adult HIV, mainly in women in Kenya who are HAMA infected, looking at effects of hormonal contraception.
Hyman?
I'm Hyman Scott. I'm an Infectious Disease Fellow at the University of California, San Francisco. And my research is with Susan Buckbinder in the Department of Public Health. And I focus on HIV disparities and trying to understand why the disparities exist and developing interventions to try to reverse them.
It looks like we're doing programs on all of you folks' career moves, and I look at what we're doing in the work of basic science, which is really enormously exciting, the field that you're in, and we try to make it more exciting for the people in the audience because it is the first step before we get into the clinical research. And we talk about the non-human primate work that is being done, and none of us want to see that have to happen, but it is a critical part of our research, and we'll be doing a piece on that as well. But tell us about your specific challenges that you all face, and maybe let's do the good and the bad, the challenges that you have that are difficult and maybe you haven't conquered them, and some maybe that are something that you challenged and you pulled through and you were able to come out on the other side. It's got to be a lot of that going on in your early life in the research.
So in basic science, there are probably more failures than successes doing experiments in the lab. So you have to be confident in yourself and know that you just have to try a few more times, troubleshoot your experiments, you're going to figure it out. And even if you get a negative result, that's still telling you something, you're still learning. You just need to be brave also and learn to think critically about the data you're seeing, not just inherently trust a talk or an article you read because it's somebody really famous in the author list. You need to be able to look at the experiment. Did they do the proper controls? What are the results really telling you? Be able to interpret the data yourself. But it makes you a much better scientist and critical thinker. I think challenges for our field right now is the lack of funding. Specifically with the sequestration we just went through, the NIH budget is getting cut again. Our university is looking at a loss of $20 million in funding, which means less training for graduate students like me, less opportunities for us to travel to conferences like this, less opportunities to do experiments that we think are really important for the field.
So Jed, how do you feel your challenges are?
Yeah, I'll echo some of those things as well, but I think my main challenge is, for a long time I've been doing clinical training, and then all of a sudden I switched gears completely into this research world, which is where I've been wanting to go for a long time, but you feel sort of behind, and so you are trying to catch up into a very rapidly moving field, and what I work in is cardiovascular and metabolic complications of HIV, and that is just extremely fast moving, and there's so much work being done. So you're trying to not only learn the field already as something new, but then trying to move it forward at the same time. So I think that's very challenging. But I want to echo something that you said as well, which is the funding issue. Everything that my work, and the work that from all people around us requires funding, and there's such a high pressure for us to acquire our funding. And I am worried about everything that's happening to the NIH budget and what it really means for my career. And I actually don't know what it means for for the next 1 to 2 years or even for the long term.
You'd think that you'd be free of worry for that because of the field is so important.
Right.
And of course, we all have that sense that what we're doing is really the most important, but it really is. It really. I don't know anybody that in science that would say that science isn't the most important thing that we've got to go, because it is the thing that is going to make people well and considerably improve quality of life in the future. And yet we put, a second-rate sense of proportion on the funding and so forth. It just is amazing. And Summer?
Yeah. I feel like I've actually been incredibly lucky to do the work that I've done. As a medical student, I found a really good research mentor and I was able to stay in Seattle for my medical training and continue that work. But there are certainly challenges. It's hard to be in the medical field and not hear of the challenges on a daily basis, mainly echoing Adrienne's concerns about funding. Especially physician scientists who have to think about how much clinical work they want to do versus how much research they may want to do, and then where to get the funding to do all of that. And so that's going forward. I'm hoping to make a move into the world of pediatric research and global health and HIV, and I think that'll be my next challenge, is figuring out how to do that now that I've established this work in adult HIV. So.
But that was one of the questions I was going to approach you all, and you're kind of getting there because that's critical, is maybe getting yourself cross-trained, and this is, of course, a great opportunity to do it at a conference like this. I always wanted to learn more about this, and so you can put yourself into those seminars. And but it seems as though that's the way it goes. I mean, I think maybe in the old days, people would say, okay, when I was a kid, I wanted to be this. And you went towards that, and that's where you ended up. But this ability to be flexible enough to take the best of you and say, okay, this is how I can see myself, in not necessarily having fun, but just say really something you enjoy. And it may have not been quite what you were doing initially because you had to do it because it was available. But then you say, like, you're moving into something that is maybe where your heart is, really.
Yeah.
So, Hyman.
Yeah, and I think echoing that is I'm a physician and being trained clinically, and going from the clinical care into research is a totally different skill set. And for me, I'm interested in HIV prevention, which even for physicians is not always the place where the research leads them. So finding my place within the medical field in a university setting with a focus on prevention with those who are not infected, because my training is all in care of HIV positive patients from a clinical side. So I think finding the place for where I fit in with that and my focus and passion for doing HIV prevention work.
Does some of what guides you into a vocation bear on the fact that you want to have that human connection because it then invigorates you to become more passionate or emotional? Or how does that play out? Because some people don't want to get into that because it's too difficult. I know a doctor, and I won't mention her name, but the early days were grim. And she said she had 400 patients that died, and it was just at the end of she was early on at the end of her career, because she just literally was burned out. So that is not quite the case today.
Yeah.
I mean, we probably have that with cancer, but maybe not so much with AIDS. I mean, people are still dying. People die every day, but we have to really think about, does that bear on how you make your choices, whether you maybe want to get into basic science because you don't have that immediate contact with people and it bothers you?
I think a big part of it is your mentorship. And I think who you connect with and who sort of supports you and helps you succeed oftentimes helps lead you down where you end up eventually going. And I think for me that was sort of what guided me towards the prevention side, and sort of the mentorship. And from the clinical side, seeing patients with new diagnoses and understanding the risks that went into what happened when they became infected, and interest in trying to help people understand their risk and protect themselves through prevention is sort of how I got an interest in what I'm doing.
And you already talked about a little bit, maybe you want to expand on that, how your choices were and how you made them.
I learned a long time ago, I absolutely need the connection with people to be motivated and go to work every day and work hard. And I think that's what I mentioned. One of the challenges for me is figuring out how to balance working with people and then also doing research.
Yeah, yeah.
And absolutely influenced by the mentors we meet and work with.
Do all of you have mentors that you work with? Is it one mentor or is it multiple, or how's that?
So I have 2 mentors, one who I work with on a day-to-day basis and a more senior mentor. And I think, just to echo everyone, it's absolutely critical to have a mentor to help guide you through, and because you look to them and you see how their careers have gone and try to emulate, the best of what they've done. And it's really important to help them shepherd you, because you don't know, how to start your fledgling career. You don't know which way to go, so you really need the guidance. And
That grounding.
you really need the grounding. And so I also feel very lucky to have a very good and excellent primary mentor. And
You said with Stephen Greenspoon?
So Stephen Greenspoon is one of my senior mentors, and my primary mentor is Dr. Jean Triant, who works primarily in cardiovascular epidemiology and HIV patients.
Is you say he or?
It's she.
She, okay,
Dr. Virginia
she
Triant.
is a younger doctor?
She's a younger faculty member. That's
Would
correct.
that be more helpful to have? Because in all of the older they are, then maybe the less they are disconnected from the early days of the challenges, which are very different today than they were then, I'm sure.
Yeah. It's actually useful to see both perspectives. See someone,
That's a nice idea.
later on in their career who's seen HIV through a long period of time, and someone who's more junior. I agree.
Adrienne?
Yeah, being at a university, I have a really great opportunity in that a lot of our faculty members have been in the HIV research field since the very beginning. And so they were the ones that were involved in describing the virus life cycle, some of the drug development, and so they have an extreme wealth of knowledge that you can draw on. And then we have younger generation of faculty members who come in who are really up to date on the latest technology, and getting that synergy together has been a really amazing learning opportunity.
None of you were around when Jim Curran and others at the CDC uncovered AIDS, or GRIDS as it was at the day. But I'm sure you've read about it, you've learned the history, and you probably learned a little bit about activism from Paul at the conference opening plenary, or the pre-conference plenary. But it is something that we are thinking about all the time as activists, because we were promised many times this roller coaster that we're on. Oh, we found the cure. No, we didn't. No, we found the cure. We didn't. And so there's that, and there is the issue that there will be a cure someday. I really believe there will. And I want to feel from you guys who are brand new, who have had a little touch with this already, and I'm sure you'll hear more about it at the conference, but how do you all feel about the cure? Would you love to be a part of it? What do you feel the cure is, or just give us your take on the cure? Just, position yourself. And I mean, I'm not wanting any hype. This is not a sales pitch. We know that there's going to be a cure. I just know that in my heart of hearts. But it is a long road. And I'm just thinking maybe some of you will play a part in that. I mean, prevention is another thing. We have treatment as prevention. We have, we really need something more than that. But it is. Give me your take.
I'm going to take a twist on that because I'm actually in the vaccine field. And
oh, yeah, there you go.
I think there are some very promising ideas for a vaccine, and obviously that would be preferable than spending a lifetime on ARVs or potentially have a long wind down to a cure strategy. So I think we have great minds, and there are some really interesting and novel ideas that are being tested right now for vaccines.
So you're talking about a therapeutic vaccine as
Actually,
well as
a preventative,
a preventative? Okay,
Yeah.
all right. Sujit?
Yeah, so this is certainly out of my field, which is more the chronic complications of HIV. But coming to CROI, I definitely feel excited about hearing about things like vaccine and really addressing the latent reservoir issue. I think that's something that I wasn't as very familiar with, and I'm really excited to hear about that because that does seem like a very promising area. And I'm excited to hear more about that at CROI.
Right, because all the cardiovascular issues would, not all of them, but many of them would be reduced and ameliorated because of the getting rid of the virus would be a big plus. We know that now.
Absolutely.
Yeah.
Yeah. I have to admit I'm a little jealous of the basic scientists in this field because it's certainly where I think the cure will be found.
Yeah.
Of course, it still has to be translated and implemented into the clinical setting. So we heard last night from one of the talks that even with like mother-to-child transmission, if we use prevention as treatment, we still have way too many infections, and so we definitely need a cure. get to it. And then when you find it, we'll work on implementing it in the field.
The implementation side of it.
Yeah.
So it looks like you're feeling pretty solid in at least the area of your work. I mean, and I understand you'll probably end up as a basic scientist, which is, I got to tell you this a quick story, real quick. We had a doctor who came on the program, was a basic bench scientist, and I said, at the end of the day, how do you feel at the end? Maybe you'll actually be a part of a cure. And he says, well, no. He says, I just generally go home and sit down on the couch and watch TV. I'm thinking like, oh my God. You know what's amazing is the presentations I've had and the way people like yourselves have presented themselves to me at these meetings, and many of them there were, everyone has brought inspiration to me, and I'm sure to each other. But that's the only time I ever had anyone that did not give me a really exciting answer. You know, it's just like, it was an OMG moment. So, and what is your take on this?
I think it's exciting. I mean, I think if we can get to a cure, that would be revolutionary in so many different ways. My concern is that it won't be accessible to everybody who needs it, and I think that is, as we think about
if it's very complicated and expensive.
Yeah, or even if it's not that complicated. I mean, I think there's a lot of systems in the U.S. and developing countries where the majority of HIV is. In emerging markets, that we need to make sure that the advances that we have, ARV is a perfect example. The mortality in the U.S. and Western Europe went down dramatically, whereas the rest of the world did not. And I think we will fall into that again if we're not conscious of sort of making sure it's available to everyone, sort of globally.
Well, part of what you're doing here is exactly what we have to do as activists, is what I qualify myself as, because we have to promote the idea of what we're doing and the reality of what we're doing, not hype or hope, just stupid hope. We have real hope, and the real hope is a long road, unfortunately. And one of the things we labored over at a pre-meeting today, on Saturday, on the cure, was this concern that the people who are going to be going into the trials should understand that these are preliminary trials in many cases. Many of them are not going to answer the question directly or finally, but they will be an answer, as you said before. We answer sometimes questions that are negative, and it's an answer, and that moves us forward. One of the things I was a part of was a Cochrane collaboration, which was to a database of all the randomized controlled trials, so that we didn't necessarily, a lot of times the trial is technically a failure, meaning it doesn't have a positive outcome, but it's an answer. And if you don't publish that somewhere or print it somewhere, people are not going to know that it actually happened. And only the best get to be published. They say publish or perish. So, but you could spend your lifetime doing research that answers questions and not publish, I guess. Wouldn't that be a terrible thing? But so how do you feel about moving forward? Like, just say the conference. How do you feel about the conference? Is there something here that you're wanting to get out that is special to you? Did you come here excited about one particular presentation or maybe a type of presentation? Do you want to start with Hyman over there?
Sure. We were talking a little bit earlier about this session today, where they're going to talk about the baby from Mississippi that was cured. So I think that's one of the things that I'm excited about seeing. There's a lot of work around hepatitis C as well that I'm really interested in seeing. I think as people are living longer, that the co-infections have become extremely important in people's health overall. And some of the new strategies for prevention that sort of focus on some of the structural interventions. The VOICE study, for example, is going to also be presented today, results from that around PrEP. So I think there's a lot of prevention, treatment, and the cure presentations that are very exciting, and getting a chance to see those would be really cool.
Since none of you were at these meetings in the past, there will be a lot of times where you just can't believe that they put a certain presentation in a certain size room, and you may be sitting on the floor, and all you may be able to see is bodies around you. And but it's daunting sometimes when the rooms get really hot, and there's not room for anybody. And well, they do actually have hallway monitors because there's no room inside. So it's pretty exciting when you see those happening. And then some of the rooms aren't nearly as packed. But it is exciting to me when you see that kind of energy in a room. Everyone eager to learn. And Summer?
Yeah, I mean, yesterday I think there were 3 or 4 overflow rooms from the part of the conference in the morning.
Yeah.
And it's so fun to see everyone sit down with their books and like circle everything they're going to. I'm like, oh, what are they looking at? Oh, that looks interesting.
Yeah.
But I find that I circle something in a different field of
So
HIV research.
You're really wanting to broaden.
Like,
your-
oh, that cure talk looks interesting,
Yeah.
and then prevention, and then I've done some work in co-infections with hepatitis, so I want to see some of those talks. And
Yeah, it's the only place you're really going to get that because it is
Yeah.
in the most, well, they call it the preeminent conference in science in HIV and hepatitis, and it does have this broad perspective. So when you have that opportunity, if you go to an AASLD meeting, you're going to be talking about your hepatitis, and that's it. But this does cover a lot, and of course it is multiple infections rather than mono infection, which is what they talk about largely at the AASLD. And so, Jet?
Yeah, I think that I'm certainly excited. Even though I'm coming from one field, I'm excited to learn a lot about other ones. And one of the things that particularly excites me is the hepatitis field as well, because being clinically grounded, you see a lot of patients who are co-infected, and for a long time there's nothing you do about that. We can treat their HIV, but we're sort of just monitoring their hepatitis C, and I think that's one really exciting field that is moving so quickly, and I think it's just going to completely change our clinical practice. And I think my clinical practice in the next year will be changed because of some of the things that come out of CROI, and so I find that to be really exciting.
Because the treatments today that are going forward and they're just learning are really much more tolerable than and I think a lot of people say because they don't, this is a process of 20 to 30 years of degradation that it doesn't happen acutely. It's more of a chronic disease. So you can wait, and that's when a lot of people are doing this. So then at that moment there's going to be this big run for the stuff that's going to get them through it really quickly. I guess I don't know what the number of days or months it's going to be, but it's going to be a very shortened course. For some people, they have a way of knowing early on whether you're going to be an early responder or not. So how do you feel?
I'm incredibly excited. Just the fact that I get to present my work is really important because I'm getting feedback from the top scientists in the field, which is great and means that I'll probably have a whole list of experiments to do when I get home. And then a chance to see all the clinical presentations and public health presentations really is able to put what we do in the lab in context as far as global health and how we can implement things that we discover in the lab in the clinic, just like the talk last night from Daria Hazuda with the integrase inhibitors, to really see the chemical structures, the screening process, all the way to you have a drug that you can treat people with and is incredibly successful.
That was an exciting presentation because it did cover the process.
Yes.
And I think that to me is a great way to open a program of understanding. And I think she's very, very talented in what she does, and she's a great communicator in the work and certainly well acclaimed for the work that she's done over the years. So how are your families? Do you find that they're all excited for your careers, the typical mothers and dads?
I think my parents are still trying to figure out exactly what I do.
Yeah.
They say, "Oh, you're a doctor." I'm a doctor, but I'm not actually seeing patients most of the time, doing research. So I think as I explain to them sort of what my interest is and what I'm doing on a day-to-day basis, they're really excited and interested. They like to come to conferences sometimes if I'm presenting to see the presentations, and it's a vacation for them, but it's also an opportunity for them to interact with me and the people that I work with. Since I am in California, my family's all in Chicago, so I don't get to see them in the same way as if I was in the same city as them.
But it seems as though that the parents are going to play a part in anyone's life who's getting into this, in any field for that matter. They help you. They're your early mentors. So how does this work? Is this something that they seem to be very supportive and so forth? Do they really support you in moving into the field, or do they say, "Oh, that's going to be a challenge, too much for you," or whatever? I mean, because it is, to me, HIV is probably the most complicated disease there ever was. So.
I have a unique situation that both my parents are scientists, and my dad actually works in the same field. He's also at this conference.
Oh, great.
And so he gets to come see my talk, and so I grew up in labs. That's where I feel most comfortable, and so they've been incredibly supportive and also incredibly helpful in writing graduate school applications, navigating mentor-mentee relationships,
Huh.
So it's been
My goodness, she
really
has an
fun.
ideal life. And
Well,
mentors from
it's also
home.
that I have extra committee members in my house, so whenever I have a thesis, I've given my thesis committee presentation over Thanksgiving. But it's been really fun.
That sounds exciting. How about you guys?
Well, so I work in this field of epidemiology, and sort of funnily, my father is actually a biostatistician,
Oh,
and
okay.
my brother actually works in bioinformatics, so has a lot of statistical knowledge as well. And actually, it's not something that I feel very comfortable with at all, in statistics. So
Yeah.
it's sort of funny that I get to ask them questions. I don't often understand their answers to me, but it's nice to have family members in a similar field.
It's almost like learning a language at home.
Yeah.
You've got that ability. Yeah. How about you, Summer?
I think this group of us is a good example that it probably doesn't matter what they do as long as they're supportive.
Yes.
So my family, I was the first kid to go to college, so in like generations, and so but they were so supportive from early on. Whatever I wanted to do, I was like, you're going to do it. You're going to be great.
Yeah.
And they may not totally follow what I'm doing, but they are proud of me and excited.
So before we part, I just wondered if you have anything about your presentation that you thought was worthy of revealing here. We are going to embargo this so that the CROI won't jump all over us, because we don't want to have this, they don't like anything to be presented before it's time. And but if you do have anything you wanted to reveal, it will be launched after Wednesday, which is when I think the last of your presentations will be presented.
So I've developed a novel version of SIV, which is a simian HIV, and we've made it so that it no longer targets the CD4 T cells, and basically tried to create a system where what would macaque or human be able to do with the virus if they had a full, healthy immune system. So we've got some pretty interesting results about basically what is your body capable of doing if it's allowed to do what it's supposed to do.
Mm-hmm. Yeah, a natural way.
Yeah.
And Sujit?
So I'm presenting data on a study that I've worked on, studying aspirin use for prevention of myocardial infarction or heart attack
Okay.
in HIV patients. And so we have some interesting results in that aspirin is really underutilized among the HIV patients as a primary prevention mechanism. But as a sort of secondary part of the study, we also looked at whether aspirin is even associated or has a differing effect of preventive effect in HIV versus non-HIV patients, and it looks like it actually might have a different effect and then might not be as protective. But I think really what this would spur is a need for a clinical trial on aspirin use, or really just better preventive MI prevention in HIV patients.
We're talking the 80 milligram or 81 or whatever.
Not necessarily looking at dose, but just aspirin use in general, and whether that has a relationship with MI.
The one thing I did learn that in my life with AIDS is that people who are living with AIDS are very committable to everything, and different than most people outside of HIV. I mean, you learn to take your pills on time every day. That's just the way it is. So adding another pill and an aspirin is, you're committed to it. So I think the follow-through would be certainly more expected from a person living with AIDS than people with just cardiovascular disease. So that might be another confounding variable in the grand scheme of things. And Summer?
I'll be presenting on a study about injectable hormonal contraception and its associations with cervical HIV shedding, which may have implications for transmission risk and infectivity of HIV. So there have been some recent studies suggesting that hormonal contraception increases transmission risk. And we looked at women who were also on antiretroviral therapy and found there was no association between hormonal contraception, in particular Depo-Provera, on cervical shedding of HIV. And suggesting maybe we should think about if women are wanting to start hormonal contraception, having them also start antiretroviral therapy, especially in this era of prevention, or treatment as prevention.
Yes,
So.
absolutely. Hyman?
So I'm going to be presenting data from a study where we tried to figure out, I'm interested in the disparities that exist, the racial, ethnic, and age disparities in HIV in the United States. And we used the per contact risk analysis to look at why younger men, men who have sex with men, and MSM of color have higher rates of HIV incidence in the United States by looking at what was the risk that they had from sexual encounters. Found some interesting results.
I've been very always appreciative of the group that meets with us, and whether they're award winners or not, you all are award winners for doing the work you're doing. And and we appreciate the work that you do, and we really wish you well in your careers, however they may bend and turn and tweak on the way. So thank you very much, Hyman and Summer and Sujit and Adrienne.
Thank you.
And we will end the program. Thank you very much for watching.